Hi, my name is Samantha Cassidy, and I will be doing the lateral projection of the C spine, but I will be doing the swimmer's technique. We do the swimmer's technique because when you're not able to see C7 on the lateral image of the C spine, we depress the shoulder in order to get the image of C7. Now, if you can't see C7 when you take a lateral swimmer's, you'll have to angle the tube 3 to 5 degrees caudal in order to get C7. The technique for C-spine swimmers is going to be, for the KVP, it's going to be 96, and for the mouse, it's going to be 28. We'll be using a 14x17 image receptor and a 40-inch distance. Now for the evaluation for the image, we're going to see evidence of proper collimation, so a 10x12. We're going to make sure that we collimate down to a 10x12. We're going to see accurate X-ray penetration, and when we see that, that is talking about the compensating filter. We have to use a compensating filter for this technique because you're going from a thin part to a thick part, from the cervical to the thoracic. We're going to see humeral heads minimally superimposed over the vertebral column, and we're going to see soft tissue and bony detail in profile. Now, I'm going to have my mother, Rachel Cassidy, be my patient, and Anna Cassidy be our camera woman and light alternator. She's going to help us with our light. So what I do first is I'm going to go ahead and get my room set up. So I'm going to make sure that my tube is aligned to my wall bucky. I want to make sure that I use my 14x17 image receptor, put it in the wall bucky, and get it aligned to it to a 40-inch distance. I want to make sure I have my marker ready and put it on the right side that I'm going to have for my patient. So if my patient is going to be lateral, I'm going to have my left marker up against the bucky on the left side, and make sure that it's going to be in detail. And if you can't see it on the left side and you have light on the right, you can use your, put it on the right. Let's see. Make sure I have my shield ready, make sure I have gowns, make sure I have anything that the patient might need. Chair already out, so that when they come in, they can go ahead and sit down and we can talk to them. So we're gonna go ahead and get started. So Rachel Cassidy, hey, how are you?
I'm doing good.
All right, I'm gonna get you to have a seat in this chair for me. All right, my name is Samantha Cassidy, okay? And I'll be taking an x-ray of your neck today. Can you state your full name and date of birth for me?
Rachel Marie Cassidy, 8771.
Okay. Can I see your wristband? Okay. All right, so what brings you in today?
I hurt my neck while I was swimming in the pool.
While you were swimming in the pool. How long ago was this?
About 2 days ago.
2 days ago. All right, what happened?
I was swimming, and when I was turning my head side to side, I heard a pop in my neck.
Pop in your neck, okay. So when you turn your head side to side now, does it still hurt?
Yes.
Yes. Okay. Can you show me where it hurts?
Right in here.
Okay. And it's hurt for those 2 days?
Yes.
Okay. Alrighty. Any pain, any swelling?
Just when I turned my head left and right, it hurt.
No swelling, no bruising?
No.
Okay, no swelling, no bruising. Okay. Any shortness of breath?
No.
No? Okay. Have you had any previous surgeries in the neck area or the head area?
Yes, when I was 3 months old, I was in a car accident with my mother, and at 12, I had a plate put in my head when I was 12. So I have a metal plate on my right-hand side.
On your right side? Okay. Alrighty. So when was your last menstrual cycle?
Last month.
What day last month?
The beginning of the month.
Okay. Is there any chance that you could be pregnant?
No, I'm almost 50. I think kids are done.
Will you please sign this stating that you are not pregnant? Thank you. Okay, so I'm going to go ahead and get you to go into the dressing room and take everything from the waist up off. Do you have any necklaces, earrings?
Nope.
Okay. Alrighty. I'm going to make sure you take your bra off too, okay?
Okay.
Anything in your hair, pins?
No.
Okay. All right, but I'm probably going to get you to put something to keep your hair up for this image, okay? All right, so I'm going to go ahead and give her a gown. It's got 3 holes in it. You're going to put one arm in, the other arm in, and then you're going to wrap it around, okay? you need any help, just let me know, all right?
All right.
So while she's doing that, I'm gonna go ahead and wash my hands and put my gloves on. All right. Okay. So I'm gonna give you this cap so we can go ahead and put your hair up in. Okay, so I'm gonna go ahead and get you to put your back up against the wall for me. All right, now I'm gonna get you to face towards me. All right, now I'm gonna get you to your feet, your shoulder width apart. All right, I'm gonna get you to take this arm and put it above your head like that and try to move as close to the board as you can. Can you stable out your feet? There you go, thank you. Now, the centering point for this is 2 inches above the jugular notch, it's C7. So her jugular notch is right here, and if I do 2 inches, it's gonna be to right there. And I'm centered, right there. Lift up your chin. Okay, now I'm just gonna get you to depress your shoulder, there you go. Make sure you make their shoulders down so that way we're able to see. And I also want to make sure that my mid-coronal is centered to my IR. I'm going to get you to take a small step forward. Take another small step forward. And I want to make sure that she's not rotated at all. Make sure her hips aren't rotated, and her back and her chest. The breathing for this is going to be suspended unless otherwise noted by the physician that they want to use a special breathing technique to blur out the lung anatomy. But for this, we're just going to go ahead and use suspended respiration. Okay, so she's all right, she's all good. Her arm is out of the way and her shoulder is down and depressed. And her chin is up. And she's centered to the IR, and we want to make sure that we go ahead and shield her. All right, I'm going to go ahead and tell you, can you take a deep breath in? Let it out. Don't breathe. Do not move. Beep. You can breathe. So she's all done. Now you can go ahead and relax. And my marker's already up there, so I'm good with that. I'm going to make sure that it's in the light field. I want to make sure that my light is collimated down to a 10 by 12. Now this position is either done upright or recumbent. Now since we did her upright, she can either be seated or standing, but since she was able to can stand, we did it standing. Now if we did it recumbent, she would have been laying down on her lateral side with her arm behind her head and her head over her arm, or we could have used a support to hold her head up like she was laying down on her lateral side. So we were all done with this exam. So you can go ahead and go back to the dressing room and get dressed. Make sure you bring all your belongings out with you. So you're gonna go ahead and go back and get dressed. If you need any help, let me know. Okay, you're all done?
Mm-hmm.
Okay, so we'll send those images over to our physician and they'll get back with you shortly, okay?
Okay,
all right.
You have a good day.
Thank you, you too. All right, so that is our lateral projection swimmer's technique. Thank you.